Dr. Ken Landau. Thanks for watching. Let's talk about Tramadol. Tramadol is a medication used for acute or chronic pain of moderate to moderately severe intensity. It's used for adults. It was approved by the Food and Drug Administration in 1995, and then they approved an extended release version in 2005, and it's now off patent. It was originally developed in 1962 by researchers at Grunenthal. That's a big German pharmaceutical company. They were working on an alternative to codeine as a cough suppressant. But after they developed the drug, the company was the one that developed thalidomide, and the company was sidetracked for a number of years. And then finally, Dr. Schenk, working for the same company, well, he found that Tramadol was effective for a different kind of pain, and it was less addictive than the opioids. So it was approved in Germany in 1977 as Tramadol. And the clinical studies at that time seemed to show that it offered all of the benefits of the more powerful, more addictive drugs, but with few of the downsides of dependency. But remember, that's when it was used as an injection. It's metabolized completely differently when it's taken as a pill, and it causes havoc when it's taken as a pill. It was originally derived from the opium poppy plant resin, but the kind that we have nowadays is synthetically manufactured. The closest relative is codeine. It's used as an alternative to the narcotics and the opioids, offers the benefits of the more powerful addictive drugs, but supposedly doesn't make a person dependent when it's used as an injection. And when it's used as an injection, it's considerably weaker than it's when it's given as a pill. When it's given as a pill, it goes from the mouth to the stomach and intestines, it's absorbed, it goes right to the liver, and it's in the liver that it's activated. When it works as a mu-opioid receptor agonist. In other words, it works the same way as hydrocodone or oxycodone or fentanyl. And in addition, it works pretty much the same as the selective serotonin reuptake inhibitors and the selective norepinephrine reuptake inhibitors. In other words, it seems to work like Prozac and Zoloft and Effexor or Cymbalta in addition to the narcotic activity or to the pain-killing activity. Well, Tramadol itself doesn't work on that opioid receptor. It has to be metabolized. That's where the liver comes in. That's why the oral version is so much more potent. It's metabolized to desmethytramadol that's 200 to 700 times more likely to bind at the mu-opioid receptor. So it's multiple times more potent as a painkiller when it's taken by mouth than when it's given by injection. Well, prior to the approval here in the United States, the advisory committee to the Food and Drug Administration said, you know, all the evidence shows that this drug, an injection, over in Europe, lots of years of experience, it seems like the drug doesn't cause any problem, but let's be extra cautious. Let's set up a steering committee, actually the first of its kind. Let's set up a steering committee to look and see whether this acts as a psychoactive medication, whether there are going to be any kind of problems with it, addiction or other kind of problems. So the company was told to set up this committee, the company that made the drug, Ortho McNeil at the time. Well, they evaluated it and said there's no recommendation that we have. And actually, it gives us a competitive edge over some of the controlled substances. So, unfortunately, within years of it becoming available, there were cases of abuse that were reported to the FDA. They were reported by a variety of medical organizations and by individuals, but the FDA sort of was adamant that the drug was not widely abused. Remember, here in the United States, it's principally a pill. Over in Europe, principally an injection at the time. So they left it as an unscheduled, unclassified, uncontrolled substance from 1995 until 2014. It is highly addictive. It's easier to obtain. There was less concern by the doctors, so lots of prescriptions. And in the United States, as the opioids became more difficult to obtain, as restrictions were put on hydrocodone and oxycodone, well, there was more abuse of tramadol because it wasn't really scheduled the same way. It's commonly abused by addicts and even healthcare professionals and chronic pain patients. Lots of people end up in the emergency room from using this kind of a drug. The DEA suggested to the FDA as long ago as 2010, hey, you ought to consider this controlled substance. But it wasn't until August of 2014 that the FDA made it a controlled substance. They call it a class 4 drug. What that means is that you can get the original prescription and up to 5 refills. Now, here in the United States, we consume probably 80 to 90% of all of the hydrocodone and oxycodone. Everywhere else in the world, it's not really a problem, these drugs, the oxycodone, hydrocodone. Why? Because they're abusing the tramadol. Tramadol widely abused throughout the rest of the world. Well, the World Health Organization, the WHO, they decided in 1973 that what they had to do is they had to go and make a list of all of the narcotics and the opioids and control them. And they did that, but they did not consider tramadol to fit on that list. And as a matter of fact, there's a reason that they even today still don't consider this a classified substance from the World Health Organization, and that's because controlled substances are difficult to obtain. So if you happen to be in the Middle East, if you happen to be in Africa, if you happen to be in Asia, and you have cancer, you have some kind of a problem with pain, they don't have many drugs available. They use tramadol. So the World Health Organization has stood firm. They do not want this to be considered a controlled substance because that would limit its access. Now, Canada is considering the medicine for their controlled list. In the United Kingdom, it was a controlled substance as of 2013. The World Anti-Doping Agency, they consider it a monitoring drug. They look at the use of it. They found that actually 70–80% of all of the use in the Olympics are cyclers. The U.S. Anti-Doping Agency, they've already requested, hey, put this on the prohibited list. Well, when the patent for the drug expired, then they started mass producing the drug in India and in China. In other parts of the world, it's sold over the counter. It's sold without a prescription. It's sold on the street corner. It's regularly added to tea and to coffee. It's used by the taxi drivers. It's used as a token, a wedding token, a gift, or it's used as a bribe. In Ireland, it kills more people than heroin. It's used as a daily helper for the poor and the working classes in Egypt, where it's more widely abused than heroin or even marijuana. Widespread use in Africa has caused major problems. It's abused in Nigeria and Saudi, it's used in Ukraine, and in India, it's caused such a massive problem that they've put strict limits on the drug. In Ghana, the pills are referred to as Tramies or chill pills or ultras, or now they call them tomatoes because it reminds them of tomatoes. In fact, there's such widespread use in Africa that in North Cameroon, there was a Dutch neurobiologist who recently thought that it actually was a natural product. He found it in trees. He found it in the type of a tree called the African pincushion tree at a 1% concentration. But interestingly, it wasn't present in the South Cameroon pincushion trees. Why? Well, because it was so widely abused in the north by the farmers. The farmers even gave it to the cattle that were plowing the fields. And then all of the urine and all of the feces were absorbed in the water and then into the tree. And that's how widespread the abuse is. Well, the drug comes as an immediate release and a delayed release medication. Immediate release, 50 milligram, 100 milligram. The onset of action is within an hour. The peak level in the blood is within 2 to 3 to 4 hours. Duration up to 6 hours, and you can take up to 4 of those a day. And it's combined with acetaminophen, basically Tylenol, as Ultracet. Now, the extended release form comes in 100, 200, or 300 milligrams. It contains both the immediate acting drug and the delayed acting drug. If you're going to switch from the immediate acting drug to the delayed acting drug, add up all of the immediate drug you take in the course of a day, round off to the lowest 100, and then you take that as one pill. If you're not, you just start at 100 milligrams of the extended release a day. There's a problem, and a problem is that a significant number of people lack an enzyme, genetically lack an enzyme, that's used in the liver to metabolize the drug. And remember, the drug has to be metabolized in order for it to become effective. So if you don't get the tramadol switched to the desmethyltramadol, it's not going to relieve the pain. So in a significant number of people, there will be no pain relief from the drug. And those, very frequently, those individuals happen to be from the Middle East. They're very rapid metabolizers of the drug. They can just break the drug down very quickly. And if you happen to take the Prozac or the Paxil or the Zoloft, that can interfere with the activation of the drug too. You shouldn't crush or chew the pills or split the pills, especially if we're talking about the extended release, because that could release a whole heck of a lot of the medication all at once. Well, it can create a sense of euphoria and pleasure, not as much as with oxycodone or with morphine or fentanyl, but it can lead to addiction. The impaired control over the drug use or compulsive use or continued use despite harm or craving for the drug. And we know that there's psychological dependence and physical dependence associated with the drug. Lots of side effects ranging from nausea and vomiting and constipation to loss of appetite, increased heart rate and rash, peripheral edema, tremor, abdominal pain, decreased alertness. And in the elderly, it leads to respiratory depression and falls and cognitive impairment and sedation. And it leads to suicide. And because it has that extra effect on serotonin and norepinephrine, well, we find that the serotonin syndrome, a change in your mental status, agitation, hallucination, coma, autonomic nervous instability, with increased body temperature, blood pressure is labile, goes up, goes down, heart rate is increased, incoordination, hyperreflexia, nausea, vomiting, and diarrhea associated with it. It can lead to itching. Opioids lead to itching because they liberate histamine from mast cells. However, the itch from tramadol comes from an allergy. It also can lead to hives or bronchoconstriction, asthma-like reaction. Can cause major skin problems, toxic epidermal necrolysis, Stevens-Johnson syndrome, skin falls off. You should not use this drug if you're taking any of the opioids or hypnotic sleeping pills, or if you're drinking alcohol, or if you have a history of bronchoconstriction, asthma. It interacts with a whole heck of a lot of different kinds of drugs, the drugs ranging from the opioids to the antidepressants, the MAO antidepressants, the tricyclic antidepressants, the serotonin-type antidepressants. It works against or interacts with the anxiety medicines, the migraine headache medicines we call the triptans or the ergot. It interacts with St. John's wort and antiplatelet drugs, the blood thinners. It interacts with lithium and trazodone and flexeril and tegretol. And if you take too much of the drug, it can lead to respiratory depression and stupor and coma and muscles that become flaccid. You become cold and pupils constrict. You have a decreased heart rate, decreased respiratory rate, decreased blood pressure, and then unfortunately, death can supervene if you withdraw from the medicine. Well, if you've been taking it for long term or at a high dose, you can have a withdrawal syndrome. Begins between 12 and 24 hours after you stop the medicine. And unlike with the opioids, where the withdrawal syndrome usually lasts maybe 3 or 4 days, with tramadol lasts for about 7 days. Numbness and tingling and ringing in the ears, abdominal cramps, back pain, joint pain, confusion, hallucinations, paranoia. extreme anxiety and panic. Those are the symptoms. Now, you can get withdrawal, unfortunately, not just from the narcotic component of this, but also from the antidepressant or the selective serotonin reuptake inhibitor activity of the medication. Well, if you take the drug and if you have a reason to have seizures, this may bring seizures on. It seems to make people especially sensitive to seizures. Problem, especially if you take an overdose or a high dose, or you combine it with alcohol or with certain other kind of drugs, or if you're having a withdrawal reaction. Shouldn't be taken if you happen to be pregnant. That's a no-no. Or if you're going through labor and delivery, or if you're breastfeeding, or if you're drinking alcohol, or if you're taking Viberzi for the irritable bowel syndrome, or if you're taking quinine. Not appropriate to take this, and it doesn't seem to have any use for fibromyalgia, diabetic neuropathy, post-herpetic neuropathy, the nerve pain you get after the shingles. It's not used for obsessive compulsive disorder. It's not used as an antidepressant, and it causes cross-tolerance with other opioids. Now, interestingly enough, when we look at the commercial assays for most of the narcotic drugs, this doesn't show up. Interesting sidelight of this particular medicine is that Tramadol in 2015 was found as a possible treatment for premature ejaculation. It seems to lengthen the time between the onset of sexual activities and ejaculation by as much as 2 to 3 minutes, which might be important for those people with premature ejaculation. The cost of the drug, if you get the immediate release form, very inexpensive. On the other hand, if you get the extended release form, you get the 100 milligram, the cash price is about $128 for 30 pills. That's a month's supply. If you go up to the 200 milligram form, it costs about $210. If you go to 300 milligram, it's about $270 for 1 month of therapy at 1 pill a day. So here we have a killer. It's considered a narcotic, but not an opioid. The authorities are beginning to realize that this drug has significant problems associated with it. It's now considered a Schedule IV drug. And as we make the hydrocodone and oxycodone more difficult to obtain, the number of prescriptions of this drug appear to be increasing. And this is a drug that can cause a lot of abuse and a lot of harm. So I'd sort of suggest you stay clear of Tramadol unless there's a very good reason to take it. Thanks for watching. I'm Dr. Ken Landau.